All right, go ahead, Hayden.
The professional organization roles are to enhance the professional careers of the members. The primary purpose of the professional organizations are to help the members of the organization further themselves through networking for continuing education, jobs, and other resources, whereas an advocacy organization simply represents the members in things such as policies, legislative issues, etc. Also, just throwing it in there, the members of the organization, they just get together so that they can help each other get to places. So they kind of join together as a team. That's essentially what a professional organization is. And then the next slide is some examples of those professional organizations.
Okay. So the most significant professional organizations for healthcare administrator was the American College of Healthcare Executives, which is an international professional society of 40,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. Their mission is to advance its members in healthcare management to excellence. The most significant professional organization for healthcare financial managers was the Healthcare Financial Management Association, which is a leading membership organization for healthcare financial management executives and leaders. More than 37,000 members value the association's role. They are respected through leadership on top of trends and issues facing the healthcare industry. The most significant professional organization for physicians is the American Medical Association, that represents both medical doctors and osteopathic physicians. They are a powerful lobbying group, federal as well as local issues. They represent slightly less than 30% of American physicians. And then for ambulatory surgery center administrators, it's the Ambulatory Surgery Center Association, which is a national membership association that represents the ambulatory surgery centers, and they provide advocacy and resources to assist them in delivering high quality, cost-effective ambulatory surgery to all the patients they serve. And then the most significant organization for medical group practice administrators is the Medical Group Management Association. They have been the leading association for medical practice administrators and healthcare executives for 90 years. They provide the essential education, legislative information, and data and career resources to help improve patient services and operational efficiencies.
Alrighty, reasons to join these organizations. Reasons to join the American College of Healthcare Executives. If you're a member with them, they have a credentialing program. They call it FACHE credential, and that's basically just earning a credential in healthcare management. They also have continuing education with over 150 programs, which cost less if you're a member. They offer career services and advice. They also have publications, subscriptions to their magazines and things like that. And they also do what they call ACHE networking, which is going to put your name out there for bigger businesses to see. Next is the Healthcare Financial Management Association. It will allow you to meet colleagues and connect into your local area, people around where you live. It'll find solutions for your needs. In the member-only section, they have like discussion boards and things like that where you can ask questions. They'll send you a weekly newsletter. You also get discounts on subscription products. You can attend the virtual conference and also attend the webinars with the experts, and they have certification programs for a lot of things. I named a few right there. The American Medical Association, if you're a member, you get full access to the publications included on their website. You get expert support to help you with the practice and career. They also have a discussion board for you to ask questions and things like that. They offer special savings on insurance, financial services, medical supplies, and travel. And then they have specific benefits for medical students, residents, physicians, and group practices. They're all separate, and all the details are on their website. The Ambulatory Surgery Center Association, If you're a facility, if you own your own facility and you join, you get the ASCA Connect, which is another discussion board. You get discounts on their events, you get breaking news, e-alerts, and then you get more networking opportunities. If you're an affiliate with a surgery center and you join, you get exposed to thousands of them nationwide and put your name out there with the free listing in their business dictionary. You get discounts on exhibit space if you were to attend a seminar or a meeting. You get advertising and sponsorship opportunities. You get the subscription to their magazine, discounts on their digital print, educational resources. You're allowed to make job postings if you're trying to find new employees, and you also get a free membership to the ASCA Connect. The Medical Group Management Association, if you remember, you get access to a wide variety of online development courses and online education. You get the CMPE certification, discounts on books and other resources, and you also get a subscription to their newsletter.
So trade associations are basically organizations that are founded and funded that work in a specific industry. And what was listed was HSCA, and that stands for Healthcare Supply Chain Association. It's made up of 14 group purchasing organizations, including for-profit and not-for-profit corporation purchasing groups, associations, multi-hospital systems, and healthcare provider alliances. And it asked to give an example of one, which was actually pretty difficult, like we talked about before this recording. But one that was listed was the Children's Hospital Association. It's a group of 43 hospitals that specialize in healthcare for children. It's a group of non-competing, freestanding children's hospitals, and they make about $25 billion in revenue, and they also receive donations. And that's it.
All right, great guys. That was a really good job. I hope you learned a lot when you were learning about the different professional organizations. And one thing I would suggest as young people in the pursuing a degree, if you are pursuing a degree in healthcare administration, that you look into some of these professional organizations to become a member yourselves. Surprisingly, or I guess not surprisingly, but if you look into a few of these, like ACHE, HFMA, they actually will allow students to join for free or at a really discounted price, and so you can have access to all their materials.
That's what Group 6 was saying, right?
Yeah. Yep. And so these are, they're great organizations to be a part of. I'm a member of ACHE. Working towards that, getting that credential of the FACHE, which is a fellow in the American College of Healthcare Executives. It's a very good credential to have. It's really well known, and people have a lot of respect for that. So get involved in these organizations while you're younger. It will definitely help you in your career in the future. So I'm going to go ahead and just start asking you the question that I ask everybody, and just kind of work my way across. But I'll start with you, Audrey, since you're the furthest on my left screen here. But what was one thing that you learned about these professional organizations that maybe surprised you or that stood out the most? And you were on mute, so don't forget to unmute yourself.
Okay, yeah, thanks. I was talking the whole time, sorry. So something that surprised me, which I'm kind of embarrassed to say, but I kind of just thought everything to, I guess, be their own hospital and like their own form of business, I guess. And I know that there's like clinics like the Intermountain Health Center, and I know that they're kind of all throughout Utah and a little bit in Idaho. But I never connected that with what we're learning about right now. And so that kind of surprised me, and it helped me get a better picture of everything. And it kind of helped me I guess, focus more on what I wanted to do with my career. Yeah, so I thought it was really interesting learning about, and I'm really glad, like through the readings and everything, it's all really interesting, and it's nice to really apply stuff that I've learned and I've read to my actual life, if that makes sense.
Yeah, great. Thank you.
Mhm.
Cody, same question.
I thought it was really cool to learn about these because I'd always heard about these different kind of organizations, but I never really looked into the details of them. I've known for a while that I wanted to be a healthcare administrator, but I never actually looked deep into it like this. And so even something as small as like the newsletters that you could get every week could actually teach you a lot. So I thought that was pretty cool, not even to mention all the big things that you could come from becoming a member.
Yeah, honestly, the newsletters and the magazines and stuff like that are some of the best pieces of education that I can get to keep myself current in healthcare administration. So, yeah, it's definitely a benefit. All right, Hayden.
So one of the things I think is I thought a lot, well, you guys probably have an app called LinkedIn, and I just thought a lot about that as I was going through these professional organizations, how that's kind of what it is. It's just a collaboration of members getting together to help each other stay aware of what's going on and of opportunities coming up and things like that. So it's just kind of neat to be part of like a group or an organization like that.
Yeah, definitely. That's great. Thank you. Myra.
Yes. Yeah, I agree. I think it's really cool that you can get help, and you know it's free, and they have all those programs that can help you. But what impressed me when I was doing my question was the Medical Group Management Association. They impressed me because they represent more than 33,000 administrators and executives, and the healthcare organization where they have, I think it was, the number was 385,000 physicians practice. I was just amazed with the numbers. Like, they cover a lot of these doctors.
Yeah.
That was pretty crazy.
No, it's really cool to see the footprint that some of these organizations have, like ACHE or MGMA. They cover a lot of people, and they offer assistance to so many people. I mean, ACHE extends around the world, not just the United States, and so I've been able to go to their conference. They have a big congress every year in March in Chicago, which I don't know why they do it in Chicago in March, but they do. And I mean, it's cool that you meet people from all over the world that are doing healthcare administration, and you get to learn all sorts of things. So it's great. So thank you guys all for doing this. I'm going to go ahead and stop the recording right now.
Okay.